Welcome back. It's Larisse Moses, and I'm sharing my 19-year journey of healing from uncontrolled high blood pressure and hypokalemia, low potassium, that resulted in finally a diagnosis of ConnDisease or hyperaldosteronism. At the end of our last video, I had the surgery, and I wanted to talk with you about post-op and healing that whole next year. So as I pointed out, the thing I would go back and change is that I would go and have had my PCP lined up, already given me a prescription for real pain medication, not muscle relaxants and not 500 milligram Tylenol or gabapentin, none of which touched my post-op pain. That was the biggest thing I wanted to share with you. But there were some other things that could have gone a lot smoother, and I want to share that with you. So the upside is I was off all medications except for one blood pressure medication. And I had been on 4 to 7 medications for both of those issues plus some of the symptoms of insomnia and anxiety. I was on other psychotropic medications, so I just wasn't feeling good. And a lot of it was all of those medications. So getting off of everything except for one blood pressure medication, once I was through the post-op pain, was incredible. I felt 100 times better, 100% better. So what I could have done also is I could have lost some of that belly fat, which would have made my recovery easier. You do have numb, I wasn't expecting this either, you do have skin that's numb but also painful. And that lasted for a long time, which is a weird combination. And again, the lower abdomen, front abdomen pain that I had for at least 9 months probably was because of the pull of my skin, because I've got a big tummy. So try to lose as much of that tummy as you can and strengthen those back muscles, because they do cut through the muscles and they're cutting through nerves to go in through the back, which is the best way to do it. They're moving organs around. You're just going to have pain. But had it been controlled properly, I would have no negative feelings about that. The other thing that I did pretty quickly, within 5 days when I kind of figured out what was causing that front abdomen pain, I ordered maternity-style underwear because they're very supportive in the front. And had I done that, I mean, they do give you a belly band, but that doesn't really, it's very uncomfortable. It loses its elasticity. And so even if you're a male, I would look at ordering controlled top underwear. That's such a weird thing to say, but trust me, for months afterwards, it helped incredibly with my abdominal pain. So the two things I could have done differently that would have made so much difference was the lining up pain medication and getting a controlled top garment. Again, they monitored, my PCP monitored my blood pressure, and we weaned myself off of that one blood pressure pill over a 6-month period. I think I could have done it sooner, but I was willing, after being able to get off of so many medications. I was still on the psychotropic sleep medications. That was another journey. But the anxiety was pretty much gone, and I'd had it for so long that it's been great. Let's just put it that way. So if you do end up having the surgery, whether they just take the tumor or they take the whole adrenal gland, you are going to feel relief. I felt relief immediately, so I can only speak for myself. But the reason I'm doing this video is there just weren't any on YouTube when I was trying to do my research about what it really was like by someone who had had the surgery or gone through the journey. So just know that you will eventually, that post-op pain will go away. There are things that I used nerve skin cream, that also helped those numb yet stinging, hurting skin issues. That helped a lot. And hopefully your surgeon, I did have a great PA, and I did tell her what could have gone better for me. And she took note and said that she would be sure that pre-op they would stress to arrange for your pain medications with your own doctor. Because surgeons don't like to give out scripts, and I get that because of the opioid crisis. So I hope that this has been helpful to you. And if you have your own experiences to share, please put it in the comments. Again, please like. You can subscribe. I do occasionally upload videos that are informative from my own experience. And I just hope that your journey is shorter than mine was and easier than mine was, thanks to me sharing my experience. And God bless you.